In Guyana, more than 8,400 people are living with HIV and AIDS. The first case of HIV was diagnosed in 1987. By 1990, the country had the region's highest HIV prevalence rate of 2.5%. Non-governmental organizations, or NGOs, play a critical role in fighting HIV and other health and social problems. The drive, passion, and commitment of individuals working through NGOs is a powerful resource that has shown remarkable results.
Our NGO partners actually account for 31% of the HIV testing that we did annually for last year. And so it clearly shows to us that NGOs do have a vital role, and that role must continue in terms of us reaching persons that we would not otherwise reach, because most of those 31% tests that were done was tests done to key population members who feel a lot more comfortable accessing the service at the NGO.
In 1999, a group of 9 NGOs started supporting the National HIV/AIDS response and formed themselves into the National Coordinating Committee, or NCC, to enhance collaboration among NGOs working in the HIV/AIDS arena. These NGOs delivered HIV prevention, care and support services among the general population throughout Guyana. At that time, stigma and discrimination was widespread, driven by fear and a lack of knowledge of the disease.
I was being tested HIV in 2009. My husband died and left me with all these 7 children, and I'm the only breadwinner in the family, so I couldn't stay to get myself deteriorate, so I had to learn. So my social worker, she started sending me to do different training. And then I said, no, something, I'm not gonna let HIV take me anywhere. I gotta fight HIV.
To watch people not wanting to come to an NGO because they're fearful that someone might think that they're HIV positive, to now watching people coming to get tested, coming with their partners and not being fearful, from the youngest to the oldest. I think for me that's a great achievement.
People are feared to be stigmatized. So they also are self-stigmatized because they feel if they go to a particular place, because maybe they had an intervention already where they feel stigmatized there, or somebody they knew was have been stigmatized.
And so we have to work very hard within our agencies, within our organizations, within our home systems to bring ourselves to the point where persons are free of not feeling afraid or ashamed of bringing themselves to the point where they don't have to worry about talking about living with the disease, of being known as someone who's diagnosed with HIV, but to be comfortable enough to be at a point whereby they could freely talk about their HIV diagnosis and living with the disease without fear of discrimination or hindrance in some way or the other.
In order to reshape perceptions of HIV and AIDS, the NGOs raised awareness of what HIV is and how Guyanese can protect themselves from contracting the virus. One such initiative is edutainment, a blend of entertainment and education, and a powerful tool in the fight against HIV and AIDS by helping to create positive social change through the use of media and entertainment to educate, inform, and influence group interactions and individual behavior.
Each NGO, as we moved along, we recognize have different strengths. For instance, artists in direct support, their strength was in the arts. And so when we were working in low literate communities, we know that the arts would work well, and so we employed their expertise to do street theaters and so on.
Today, NGOs are responsible for providing 25 to 50% of services to people living with HIV. With the reduction in donor funding in 2012 and recognizing the important role that NGOs play in national development, USAID implemented the Guyana Civil Society Leadership Project through the Volunteer Youth Corps, a local NGO. The aim of this initiative is to strengthen the National Coordinating Coalition, formerly the NGO Coordinating Committee for Society.
We provide very specific services for our members and non-members. What we do is assist with resource mobilization And that resource mobilization is not just monetary. When we talk about resource mobilization for our partners, it's a collective way of harnessing whatever is out there to help us and our partners do what we do best. The other thing we do is provide capacity building through strengthening of governance systems. So what we help our NGOs do is to get those systems in place. And one of the other things we do is shared advocacy, and shared advocacy for health services and other services for marginalized groups across the board, whether those groups are people in the community that's HIV positive, or the LGBT community, youth, the disabled. It's advocating for services that are accessed in an equal manner regardless of who you are and what you are. And in most instances, those services to which we find ourselves advocating for our audiences to have are essential services like health, education. And so those are two very basic things that we're very passionate about. And so we as a coalition work as a coalition in terms of the membership, and the NCC as a separate entity. Those are two very key things that we focus on.
So I think we've been able to change persons' perception of the disease itself, and also how they look and how they interact and relate to persons with HIV. The NCC has evolved and now has a membership of 36 NGOs that also respond to social issues directly related to HIV and AIDS, including suicide, gender-based violence, and child and human rights violations. Many of the NGOs have successfully implemented educational and social programs to curb these trends.
A lot of our work in sexual violence has been focused more on how we deal with the trauma and how we help children to cope, but we also need to look at the other health issues, and this is where we know that the membership within the NCC will help to grow that aspect of our work.
My husband tried to kill me like 3 times, strangle me, poison me, hold my mouth and throw the poisoning. Well, actually I would get raped every night, so that's like a normal thing. Honestly, I didn't want to go home. Like I just feel like run away somewhere far and just leave the children and everything. Like I just got fed up with the pressure. And there was a lady under the shade from United Bricklayers, and she told me, she said, I have somewhere I can take you. Come with me. And they pray with me and they talk with me, and I share from the beginning to the end of my story. It was like a burden come off of me, like a weight. When I walked out of Bricklayers that day, I was a different person.
We've had a situation where the child was trying to tell the mom that she is being sexually abused by a family member. When she actually found out, by that time the child was HIV positive, because the adult that was abusing the child was HIV positive. And so when we go into the schools to do sensitization, we talk to children about the other issues that can result from sexual violence, which will also include STIs and HIV and AIDS.
We like to encourage this kind of practice where NGOs and important persons in society get integrally involved in ensuring that we work collectively.
With minimal resources, NGOs continue to impact the lives of thousands of Guyanese. They complement the national response to health and social issues, and the need to sustain their services is pivotal. Government has its work to do, and civil society, the private sector, have all got their parts to play. But NGOs are particularly vital because of the reach. They reach the ordinary man. Even in the face of dwindling financial resources, which threaten to limit the services provided by NGOs, these organizations have proved their ability to achieve much with little, but have a long way to go to achieve sustainability. The NCC welcomes your collaboration and support. Investing in these organizations is a smart way to invest in better health and more prosperous communities.